Good afternoon, everybody. Thanks for being here. First snowy day of the fall. We had no new deaths over the last 24 hours, so positive news. Start our Monday. We've received 4,241 tests back. 7-day rolling average for our county is 1.46%. Hospitalizations are up slightly at 26, with 4 of our neighbors in the ICU. Please keep them in your thoughts and prayers. Out of the hospitalized, 19 Caucasian, 4 African American, 2 Asian, and 1 has not shared their demographic information. Overall, we've had 5,549 positive cases. That's 61 new cases. Out of the 61 cases, 4 travel-related, 1 Florida, 1 international, 2 from other parts of the state. We had 15 household contacts, very large household contact number, but again, that's going to be part of the gig. If we have high caseloads, we know that certainly we see about 10 to 15% of the time we'll get a household contact from a positive case, and that has held true throughout the pandemic. That's what's happening here. We have 36 community spread, of which we have 19 known sources. We have 4 cases that we're still investigating right now, 1 senior and 1 congregate care facility. Looking at the higher ed, we have 5 higher ed cases, of which 3 of them were transferred in. And then K through 12, we have, I believe, 7 or 9 K through 12. We have 10 K through 12, and of which some of these were remote students. So for K through 12, when we report out, remember that doesn't mean you have 10 kids or staff in the building that day. You have folks that have been put in a quarantine that could test positive. You have remote learners who have never been in a building, but they are getting the virus in the community. And so you have kids that got sick, never went to school when they were sick. And so each case is different, but we report out any school-age student that's in school and any teacher for full transparency. Looking at our cases, 3,114 female, 2,435 male, 711 under 19, 1,236 in their 20s, 750 in their 30s, 667 in their 40s, 789 in their 50s, 568 in their 60s, 357 in their 70s, 300 in their 80s, and 171 in their 90s. Related to testing, we've moved from MBT Bank Stadium into the FSHAD regional market Monday through Friday, 9 to 11 still. For symptomatic testing, at this point, anybody can go with who has symptoms. We've built up some capacity through one of our lab partners. So 2 ways to get a test there. There's 2 different labs working out of this facility. One, for a saliva test, again, this is for our students. You contact Upstate, you go on to mychart.upstate.edu, you get an appointment. That's a popular test. We have about 180 of those a day there, and there's always about 180 customers for it. So if you want the saliva test, it may take more than a day. If not, you call 315-464-2582. You can call and set up an appointment. Or you can just show up. We encourage you to pre-register. To expedite the process, you can go to ongov.net/Cayuga Medical. Pre-register. You can come up and get a test there. Again, these turn times are pretty quick, 24, 36-hour turn times related to our partnership with Cayuga Med and with Upstate. So if you have any symptoms now, there's many spots you can go in the community. Now the FSHAD at the regional market is one of them as well, and that test will be processed with our partners with Cayuga Medical. Our asymptomatic testing in schools, today we're at Jamesville DeWitt, tomorrow we're in Tully, Wednesday we're at ESM, Thursday we'll be in the City School District, and Friday we'll be in Fayetteville Manlius. Again, this is a voluntary testing program for faculty. At some point we'll expand this to students. But so far, it's been going well. One pool has come back positive. When a pool comes back positive, they then go and individually test all of these samples within the pool. The process is certainly working the way it was designed to. This past weekend, we've seen through contact tracing stories about social activities happening in businesses. We put out a pretty aggressive enforcement detail out over the weekend, Friday and Saturday nights. I'm thankful that most of the businesses that we went to were doing the right things. Their customers were doing the right things. And if that continues to be the case, we'll see cases drop. There's a direct correlation with some of these facilities and increased cases. Again, we need to, when we're sick, we got to get tested. Every excuse in the world. I only had, a sore throat. I didn't think anything of it. We got to be aware of our symptoms. And if we are, and we get tested and we stay home, we have quick turn times, we'll get these case numbers down. And then when we're doing the right things with distancing at some of these establishments, that means that even if you have somebody positive, if everybody's following the rules, we won't have widespread in that facility. So these are things we got to have. I think we stopped at over 50 establishments over the weekend. I think we had one fine that was given out. So 90, what is that, 50, that's 98%, Andrew? That's pretty good, right? Compliance. Again, this is something that we're worried about, these gatherings moving forward. And we'll continue to have these units going out based off of what the data tells us. Again, something that we don't want to do. It's just something we have to do in the pandemic when we know that there's blatant violations happening within the community. Cases and contact tracing, we had a busy week last week. We're going to be busier moving forward as our activities move indoors, but last week was very busy. When you have 60 cases, then 70, then 99 cases, then I think we're back down to 70, then 67, 61. We're going in the right direction now, but that's a lot of work. Let's use common sense. If you have a positive and your doctor tells you you're positive and you haven't heard from the health department yet, they're coming. You know you're positive, you isolate. You isolate from your family. And if you're in direct contact with somebody, even if you haven't heard right away and you hear via that the person that you're in contact with, it's coming. The call's coming. You quarantine. Let's be smart. Due to the increased activity, it's taking us a little bit more time to contact people. So we know the rules. We've been in this pandemic. If you've had a direct contact with somebody, you know you need to quarantine until you hear from our health department on the guidance. Obviously, if we're positive, we know we isolate. So this is something that we just need the community's support on a little bit. And the call is going to come, and you're going to hear from our health department. But we need to use a little bit of common sense on this. To give you an idea, we now have 1,841 people in quarantine and 522 active cases. So the workloads in 1 week have gone up significantly. Our active cases, I think, doubled in 1 week because of this upswing. So to get the upswing going in the right direction, we need to get tested and tested and tested, distance, avoid large gatherings, and then when you are exposed, please quarantine and don't go on with your business until you hear from the health department. Saying that, I'll take questions.
Mentioned in your briefings last week, either with us or on Facebook, that a lot of your work had led back to social gatherings at bars and restaurants, but then you send out inspectors and you only find one not compliant. Do you think perhaps there were some businesses not following the rules but heard your warnings late last week that got their act together for the weekend?
Yeah, and I know that there's other establishments that weren't open or shut down early. And again, we're in this position where our goal, you all have covered this pandemic every day. You know how hard we fought to get the economy open and to get our cases low. This isn't over. If your cases get to a point and your data gets to a point where the state deems it unsafe, you go into an area of a yellow, orange, or red zone where your economy gets shut down again. That's the rules. We know the rules. So when the data tells us that rules are being broken and it's leading to cases, we're going to go and we're going to work to enforce. And that's what you do. You enforce and then you test. We don't want to be in a situation where we're giving out fines to people or businesses, but everybody needs to wake up. We're doing this so that businesses don't have to shut down because our data gets to the point where we go into one of these zones and then we have to wait 2-3 weeks to be opened up or to have capacity restored. So I do think people listened, and I do think people understood what we were talking about, but this isn't a one weekend circumstance. We saw the seasonal shift. Quietly, the virus started to spread in our community. We didn't adjust our behavior or modify our behavior fast enough. Now we're at a point where we need to get our caseloads down to a manageable number in the winter. And so we got work ahead of us.
This is the third day of decline after the 99 cases on Friday. Is that enough of a decline to start a trend?
Probably, we'll see what tomorrow brings. Certainly you want to see 4, 5, 6 days in a row. Again, we've been messaging hard before those high case days that we saw problems happening. And when you see more random cases, which we were seeing, we knew that would lead to more spread. So hopefully we're getting to the point where we're between that 30 and 50 cases a day. I don't think we're going to get back to the 10 to 30 cases a day range during the wintertime. If we do, that'd be great. But 30 to 50 cases a day, that's the range we need to be in, where we can quickly do our job, knowing that we're isolating quickly to keep our infection rate low and our positive rate low.
Ryan, among the cases that are community spread, like today, you mentioned there are 19 where it's a known relationship or source. Can you give either for today's numbers or in general? I mean, what's the most common contact point that you're seeing among those known sources of community spread?
So a known source would be we have 3 cases at Syracuse University. We know that it's related to an off-campus party. We knew the source of it, right? That happens. We have a case at this manufacturer, and now we have 6 new cases there. Those 6 cases get attributed to that known source. So you're going to see workplace. You're going to see this was all a known source right here, right? Eventually.
Yeah, but I'm asking specifically. So what known sources are you seeing today?
Oh, I don't know about today. I just get these numbers before you. I know that it's a known source, and you'll see small clusters. A small cluster is something we see from 3 to 10 cases, and then once you see a larger cluster, that's when I typically get briefed on it. And so, again, today's data, you have a lot of household contacts. 25% of our cases are household contacts. That's a big day for household contacts. So the good news on that is these are people in quarantine anyways. So the contact tracing, you go and reinvestigate to confirm that you don't need to go do a full investigation because they've been under quarantine that whole time. But that's a big driver for today's data.
What do you think about the new option for people to do the testing instead of the going right to the 14-day quarantine for out-of-state travelers, the new rule that was announced over the weekend? Have you had a chance to look into this?
Yeah, I did. I think it's a better rule. It's more feasible. We've seen that people weren't following the quarantines, and we find out about them too late. So this way, I think people understand testing get a test. You're in a community, you're traveling, there's risk. If you're coming home, you don't want to bring that risk to your family. So getting a test, I think, is something that makes sense, and I think people will comply with it more. So I support it, and you've heard me talking about this whole time. I think testing is the way you can open up gatherings in your economy. Obviously, you had a stronger case for that in the summertime when the virus was really beaten back very badly than you do now. But again, if you're testing 100 people, and 100 people don't have it, with a reliable test, what's the risk of them being together is much less than just putting 100 people in the room. With today's data, that means at least one person has it probably.
Is our capacity for rapid testing going to get to the point where that is feasible?
I think so. We're working on some of it right now. The challenge is procuring it. Most rapid tests with the labs have large contracts with the federal government and the states, and some private. So if you wanted to, say, call an Abbott's or a Roche and say, I want to go buy $3 million worth of test kits, they probably can't fulfill that order. So you have to work your way around that in the procurement process. We're hoping to get more of the federal tests that went to the state. We have some. We have to work on how we're working on getting those registered and then getting those used in an effective manner. They won't last that long, but we think we'll get more of those as well. So the rapid test is something that's infrastructure we're looking to purchase directly ourselves, and hopefully we'll have that to get us through the pandemic. But even into 2021, I think you'll see these tests go to retail, and I think you'll see some of the tests that we'll be doing available on the store shelves at some point in 2021.
The county clearly focused and had successful results on enforcing commercial businesses over the weekend. But we know that at SUNY Cortland, there were 3 large parties near campus. Any non-commercial but private events that you've been tipped off to over this Halloween weekend?
Yeah, we were tipped off, and we interacted with a couple different parties in advance. So we think that they may still have had gatherings, but we think they were in compliance. We got tipped off to other events over the weekend where we gave warnings, and potentially they did not abide by our warnings, and if we can get proof of that, then they'll get fined. So that's the thing too. If we're coming to you in advance, if we're coming to you with a social gathering complaint in advance, that means somebody you invited to your gathering is saying, I don't feel safe at the gathering, and they want us to know. And so when we reach out to you and say, please follow the rules, I didn't just hear about this. You invited this person. I'm not going to tell you who it was, and they don't feel safe. Can you just follow the rules? And then you choose not to follow the rules, then that's kind of, you know what that is. So you're going to get fined when you do that.
In terms of the travel advisory, to clear any confusion, if someone's traveling out of state for 2 days, what is the protocol?
When they come back in, they got to have a test. And so if you're traveling to California and you're coming back, I believe if you're essential, you're exempt from that. But if you're just traveling, leisure traveling, you go to California for a couple days, you need to get a test before you come back and have that result with you as you come back. So we're learning about it. I have a call later, so they're going to go through some of this with us. But there's going to be examples that are in the gray zone, not just the cutthroat. This is the rule area. So, but we'll go through all that. Again, these aren't our rules. We're just here to help enforce some of them.
Have you had a state control room call since Friday?
No, we have our calls on Mondays and Thursdays now.
Okay. I guess I'm just wondering what the 99 cases does for those kind of conversations. Does that put the state on alert that if Onondaga County doesn't get its act together, it could move into the colored temporary shutdowns again? Is that part of the conversation?
No, I don't think so. I think when you look at it, you look at the macro level if you're the state. So out of the 10 largest counties, we have the best positive rate. So before they get to us, there's others, right? But I don't work on the macro level. I work on the micro level in Onondaga County. So I have a problem with that day. and what that means, and because we're the ones doing the work, and is it sustainable to do it? And the answer is 99 cases a day is not sustainable. That will impact our ability to do our job, which then will lead to more community spread because it takes us longer to do our job, and then that leads to more hospitalizations, and eventually the medical infrastructure gets drained. But from a data standpoint, we're nowhere close to being on the state's radar if we get our act together. And that's acknowledging the virus is here again. And so we have to modify our gatherings. We have to distance. We have to wear masks. And if we can do all this, and when we're sick, we get a COVID test and we stay home until we get the result, we'll get right back into that 30 to 50 case range quite quickly.
Do you see travel testing being easier to enforce compared to quarantine, or do you see this more as just a smart move because you believe more people will comply because it's a shorter option?
I think it comply, and enforcement's very difficult. We were never able to enforce that rule. We would do our best, and if somebody came in and said somebody's breaking the rule, then we go investigate it. We have an enforcement team of 10 people. Okay, the state government the state of New York is cutting our budget $20 million for the programs that we run today, let alone not sharing CARES Act funding that came our way. For us to enforce that rule was next to impossible. So this is, I think, a very smart move by the governor. More people will comply because it makes sense to get a test and then to get another test, whereas a 14-day quarantine is tough for people to swallow just because they went somewhere and came back. So I think we'll get better compliance, and that will lead to better results.
When we saw the uptick start last week, it was important for you to contextualize not so much the pure number of cases, but the infection rate, because of the huge amount of testing you're doing now compared to March and April and May. Is there a chance, looking back, that there were 99 or more cases those days? There was just no way to tell because the testing levels were minuscule compared to now?
I think so, yeah. So I think when you look at the days in May and April, I believe were a lot worse than these days because we only had so much testing capacity to test people, so we were testing the sickest people that day and still getting these results. So our positive rates were much higher. So now I think you have a better sense of where it is in the community because we're doing broad-based testing. So these aren't as bad as May and April where we were this past week, but it certainly is an area that isn't sustainable for the duration of this pandemic. And that's what I think the public needs to understand, is that you can't be where we were. I think hopefully we're turning the corner, but over the last 7 days, you can't be there for the next 9 weeks or 12 weeks in the pandemic without it leading to bigger problems. And that's why we will pick up enforcement, and that's why we do need the public's help, and we are building up this testing capacity to levels that hasn't even been yet in our community.
Is there conversation at all here in the next month? I know most of the local higher ed institutions do plan to go remote after Thanksgiving break. Do you have any meetings or conversations coming up here in the next few weeks with SU or Lemoyne about any type of changes to that plan?
No, I think they have a plan. I think it's well thought out, and I know at some point the students come back next year, right after Thanksgiving, and so. What does that do to our numbers? Not going to impact them that much, right? I mean, maybe 4 cases today off of the 61, right? So there's been 2 times where higher ed's led to numbers, 2 parties, right? Besides that, they haven't hit our numbers at all. So that won't, I think, impact our COVID-19 fight whatsoever. It will probably, that's a lot of money that leaves the community for those months. So it'll probably hit us economically more. But because of how well these colleges have done with their programs and their testing protocol, and the students for the most part, it hasn't impacted our COVID-19 data and our infrastructure.
Last week's uptick hit a nerve again, and it gave people some anxiety. Looking at the picture today, describe for people where the community stands after the record-setting day on Friday.
Yeah, I think really it takes the 2 to 3 week cycle to start moving this virus in the right direction. And hopefully we've started that, and last week was just the peak of what was the seasonal shift and us being too comfortable. And so now hopefully people are getting, and that's one of the things that my wife Kate's told me, is that people aren't as engaged as they were in the beginning because people are working now and they don't see the stats and the data and understand it as much, and that's something that we got to get out more. We need people re-engaged on this because we did so well, we worked so hard, we have our economy opening, we're starting to see economic recovery, we're starting to see recovery in these human service areas where we've been lax, and there's been other public health crises developing. We're starting to be able to address those, so we can't get too lax with COVID or else we go backwards on everything. And that's really what the balance is now as a community. These large gatherings aren't worth it on a weekend. If you're going to have 50 people in your house, if you have 50 people in your house on a weekend, somebody's got COVID, and it's going to take out a bunch of people in the house. I don't think anybody has rapid tests going into their house to have a party, where everybody's going to rapid test and everybody's negative. That would be different. Nobody's got that. I don't have that. County government doesn't even have that. So that's where this thing is. If these gatherings that you got away with in your backyard, you can't get away with right now. And so that's the challenge, is just recognizing that, being smart with our social gatherings, and certainly when you get sick, and people are going to get sick, then you gotta get tested.
Can we expect any last-minute endorsements between today and tomorrow, and what's your plan for Election Day?
No, I'm sick of the political season. I was watching a football game yesterday for the first time, my beloved Green Bay Packers, and I haven't watched a game, and I was shocked. I know I've ran a political campaign. I'm sure my ads were not nearly as bad, but I was shocked at what I saw, to the point where it makes me really appreciate the red zone. There's no commercials in the red zone. And so I flipped back over to the red zone. But I think everybody's pretty drained by this election cycle, and I think everybody will be happy to see it run its course here.
Ryan, have the contact tracers found any evidence yet of virus transmission within K-12 school buildings?
I would have to, if there is, I'll get it confirmed. If there is, it's limited. We've watched that very closely, and that's been the trend nationally too, which I think a lot of people have reported out with different epidemiologists, that it's in the community and it goes into the building from the community, and because of the distancing and the mask wearing, has not transmitted. There may be 1 or 2 cases that you can make that argument, but also remember, people are friends, right? The adults are friends with people. They go back to work, they go grab dinner, they do things together. If you're sick and you're doing that, you're getting your friends sick. That has happened, and so what we've seen, the supermajority, I won't say 100%, Tim, is that we have not seen transmission in the buildings yet. But let me check on that to see if there are incidents, how many incidents out of our cases. Again, we've had, might even tell me the grand total here. Out of all our school days so far, it looks like we've had 222 cases with students and faculty, whether that's remote, quarantines, household contacts. They didn't all happen in the buildings or go to school that day, but out of people that go to school and go to work in schools, there's been 222 cases since the year began. Pretty good numbers when you look at all the times and how many people you've had in those buildings.
Just one more on the election. Have you heard any inkling or concern about violence on Election Day, either here or in any of the neighboring counties?
Yeah, I think Homeland Security put out a briefing, a memo on this probably weeks ago. We followed up with it. There's been no evidence of any imminent threat. We do have, so we have designated some security details to be available if polling places needed them, and I know the city has as well. So, but I think that's something that you plan and prepare for in hopes that you never have to actually have an incident.
On a much happier election note, spaghetti and meatballs tomorrow?
To go, takeout, yes. We got our order in quick. Hopefully you all did as well. And a great fundraiser. Unfortunately, it's for Our Lady of Pompeii. You're kind of maxed out on what they can do, but it's a great community event that, again, like many other events, will be different this year.
They sold out, so your meal is increasing in value as we speak.
If somebody wants to negotiate, I give my budget on Wednesday. We could use a little bit extra money. So if somebody wants to bid on some meatballs, we'll be happy to have an auction.
You reminded me of, back to a serious topic, your budget on Wednesday. What do you want to tell us now about what you're planning? What should people expect?
Yeah, it's going to be what you'll see is the grim economic realities of this pandemic, and we've talked about sales tax. Now we are having to factor in what most likely will be draconian state cuts as well. So it's going to be a budget that we will meet the moment and have a balanced budget, and our workforce will do more than they've ever had to do, just like they are now. But it's not the type of budget that we want to put forward. Let's put it that way. Okay? All right. We'll see everybody on Thursday.